if you want to learn about 3 post-op cases gone wrong and what you should not do and make the same mistakes as me, you need to tune into this episode. Hi, everyone. Welcome back to the podcast. Welcome all new listeners, and welcome back those who have heard my content in the past. If you want to learn about 3 post-op cases gone wrong and what you should not do and make the same mistakes as me, you need to tune into this episode. Before I go into the podcast, what's new? What is better? Life is good. I'm actually coming off of a family trip. We had my in-laws in town, and we explored San Diego, sunny San Diego in the LA Anaheim area. We did a beach weekend, and we did a trip to Disney. And so that was amazing. It was refreshing. And actually, the reason why I'm doing this podcast topic is because, there's sometimes when you are talking to somebody, and until you have that conversation, it brings up old memories or old things that you haven't thought about in a long time. And I went to Disneyland, and going on this roller coaster, it was an incredible roller coaster, The Incredibles, or whatever it is. It made me realize, wow, I had a patient who had a bad story on a roller coaster. And that's what really brought up this, literally, like this podcast topic. And I literally wrote everything down because I wanted to share. And it was something that I know that a lot of you guys and girls and people can all benefit from, because you don't want to make the same mistakes that I did. And if I knew that earlier, it's like some of the cases you're going to hear, you're like, oh my gosh, that's a no-brainer. However, when you're in that scenario, you're in it with that patient or athlete, you never think about these small things behind the scenes. So that's why I'm doing this episode, and literally coming refreshed off of a good time with the fam, a good time with my kids, just watching them grow. Like I love literally listening to their vocabulary grow. My son, oh, here we go. For those who've been following my podcast, my son, Jacob, officially took his first steps. I called it. I knew it was going to happen soon. Today, he did 3 steps, and it wasn't recorded, but amazing to watch him as well. All right, onto the podcast. What are 3 post-op cases gone wrong? Let me give you guys a scenario. I'm gonna give you 3: a back injury, a shoulder injury, and a knee injury that earlier in my career that I messed up on. Okay, so I failed to do something in all 3 of these cases, and I'll explain that. But when you are a clinician, one of the things that I hear a lot of times is like, I'm looking for mentorship, I'm looking for support, I'm looking for somebody to help me, right? Unfortunately, sometimes some things have to be learned, right? But the thing is, the faster you adapt them into your practice is when you become like next level PT. And I think a lot of people want to learn like new things, but the challenge is all you have to do is learn from your mistakes and fill that gap in faster, so that way it doesn't happen to you again. And these cases really humbled me because I failed to do certain things. So, all right, here they are. All right, number 1. So this patient was in their mid 40s, and they're just trying to get back to enjoying life with their family, and spend time with their kids. And they were, I think they couldn't have been more than a week out post-op, right? So they're working on their range, their strength, and everything else, and we're just starting the rehab process. And I am, let's see, probably 2 to 3 years out from clinical practice, and I remember thinking like, oh, this is pretty easy. Let me work on this. And I realized that I failed to ask a simple question. I said, wait, what are you doing this weekend? They're like, oh, I'm going to go with my family. We're going to go out to have a good time, just a family outing. I said, oh, okay, where? And they said, like, in their hometown, a couple miles away. So, okay, no problem. Have a good weekend, and I'll see you next week on Monday or Tuesday when you come back. And I couldn't believe the mistake I made. And I remember thinking, like, there's nothing wrong with that. They're going to go hang out with their family. I don't see anything wrong. It's all flat land, everything else. And they come back the following week, and their incisions are clearly infected. And I asked, wait, what happened? It's like, well, I told you I was going to go with my family. Wait. What did you do? And they said, oh, I went to the beach. I see. What did you do at the beach? I went in the water and they didn't cover their incisions. And you have to think, like, wait a minute, how does that happen? And I couldn't believe it. They literally went to the beach post meniscectomy with open wounds and went into the ocean. Now, you kind of have to think like, wait a minute, there might be some common sense in that. However, the general population doesn't know, right? Think about you having surgery. Like even you, as a medical provider, you know what is good and bad, but sometimes you don't think about the background things. And this case made me realize I needed to give more clear guidelines on precautions and contraindications. However, I think we as a profession, we're really good at a few things. Uh, I think we're really good at providing contraindications. I think red lights is what I would call them, right? And for the most part, green lights, right? Like, hey, this is what you can do, and this is what you can't do. Then there's this gray zone of yellow lights, such as don't get these things infected. You can't say that to every single person, but ultimately you want to give them what I call bumpers, right? Or guidelines within yellow lights, meaning you want to keep these things, covered at all times. If you're going to get it wet, have it, with the dressing over it or whatever you want to explain. Or you're going to go back to running. So here's what you're going to control. You're going to control your distance. You're going to control your cadence. You're going to control your time. And there's multiple variables that you can be doing. So I think we're really good at saying no to this, and we're really good at saying yes. But it's the stuff that's in between. And this person humbled me, because I think all of you listening right now could shake your head and be like, man, I could totally see where I would have messed that up. And the reality is I was early in my career, so focused on the knee. I was so focused on them actually just like getting back to, stairs and like getting back to the gym or whatever it is, or squatting or kneeling, that I lost sight of the fundamentals. And I tell my team this all the time. I said, just don't mess it up, right? Just don't mess up the case. Meaning, if you just imagine you're giving somebody like a beautiful rug, like a red carpet, and all they have to do is walk down it. And you just like, if you walk to the right a little bit more, just push them in a little bit. If they walk to the left, just push them in. You're just giving them this magical road, this roadmap. And so you put bumpers on each side so they don't like steer away. And I failed to do that. I knew my destination. I knew where I wanted them to go, but I failed to see what could hit me or them. And that's where I went wrong. So that was one post-op case that like sticks out to me to this day. So anytime I have like post-op lower extremity or arms or whatever it is, it's like in my memory now, like it's ingrained to me. What are you doing this weekend? Where are you going? How often are you going in water? What are you doing specifically? And I'll preface with like, hey, listen, I'm going to ask some questions. It's not because I'm like poking and prodding. It's because I've had cases that have gone wrong because of small things, and I don't want that to happen to you. So I do explain that to a patient or an athlete, because I think that they don't know any better. And I think it's our job, it's our responsibility to show them what's lying ahead. And I think that I should have done that, but that was early in my career. Please do not let that happen to you ever, 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 ever. There's no reason why you shouldn't know that now. So any post-op case, don't just make sure they're not going to the beach and getting infected. So that's number one. All right, number two, this was a case that I remembered at Disneyland. This is where the memory came in, and this is where I hadn't thought about this for years. And literally, I was on the ride. I came off, I was like, oh my goodness, I forgot about this case. So I went on this Incredibles ride, and it was actually amazing. It's actually fast and like lasts a long time, and it was great. I loved it so much that my in-laws and my family went on it multiple times. So I went on it, and you go sideways, you go upside down, you do all these other things. And as you imagine with the roller coaster, it actually pushes you all over the place. So I remember thinking I got locked in, and the back of my seat was pretty tight. And because you're going upside down, you have kind of guardrails over your shoulders and all these other things. And we made a turn, and had a little bit of side bending in my like T-spine and lumbar spine. And I remember hearing my ribs crack. I was like, oh my goodness, that didn't feel good. It was not the great type of a crack. And I remember thinking, oh my goodness, that's what it was. So I had a patient who we had conquered back pain. And they were having still sciatic stuff, and we conquered the back pain, but they were having referral symptoms. So they decided to have microdiscectomy. And I tried everything under the sun. They tried multiple providers. We tried to do everything we possibly could. And we got the centralized back pain gone, but they just had this residual numbness in their toes. And so they decided to move forward. And I was like, that's fine. That's your quality of life. They're in their early 50s, late 40s. So they decided to go with surgery. So we're about 12 weeks out, and they're feeling really, really good. And they decided to go on a family trip to not a theme park. It's like a mini theme park, almost like a fair. And I remember thinking, okay, just be careful. Don't do anything. And they're like, no, I'm not going to go any rides. I'm not going to do anything. Sounds good. All right. So they come back flared up. And I said, what happened? And they said they didn't go on a ride. They went on a kiddie ride. One of those kind of almost like for little like toddlers, you put them almost like a Dumbo ride and just kind of go circular, right? And there was nothing wrong with it, but the problem is that the tightening up component seized up their lower back, and they had a little bit of residual numbness go to their glute. But when they came in the following weekend, they said, I didn't think that would flare me up. And I said, you told me that you were going to this, and I didn't think that it was going to be a big issue, but I didn't consider how much tension is applied when somebody is like being reactive to bumps, to whatever it is. And it made me realize I need to be a lot more conservative when it comes to managing people, providing those bumpers. And most people think like, well, that's common sense. As a provider, like just tell them not to. However, you play this wiggle room, right, of how much you push and pull people, and you give them the benefit of the doubt. When people are asking me to push a little bit more, that means they're internally, they feel ready. But the problem is I didn't foresee the next step that could happen to them. And that's what I think, when people say like, oh, you're a master clinician, or you're a specialist, or you're insert, whatever expertise. I think what makes a really good expert or master clinician or specialist or somebody really, really advanced is that they can see what's about to hit the patient or the athlete before the athlete does. I think that's what makes really good clinicians. I don't think a good clinician is all about like exercise prescription and management and like designing the next fanciest thing. Like I think that's great, but I think that anybody can do that. I think what's really unique is the people who can see that next step, and their patients and athletes feel like it's just seamless. They're like, oh, it was easy. I just went to PT and they got me better and this and that. When you make it so seamless and all the background work that you did to make sure that they just didn't like come off of the roadmap, and they were like, you secured the bumpers and just put them on this beautiful path, and you told them where to look. I think that's what sets people up for success, and that's what makes a really good clinician. And I think that the challenge with most people, they're always striving to find the next biggest thing. And that's why I say that, it's not about the next thing. It's not about like what's new or the latest and greatest. It's about simplicity. It's about making things seamless for people and creating amazing outcomes, not by the things that you give them. It's by the information you give them so they know how to get there like quickly, efficiently, and safely. And so the lesson I learned from this case, the microdiscectomy, is I learned that I don't think we did the wrong thing by allowing them to go on, but I should have told them, you're gonna flare up. It's just how much you're gonna flare up. And I think when you provide people information like that, they can make that decision even more clearly, and they can say, you know what, it's probably not best. It's not worth it for me, because it would set them back. So knowing it now, I would have phrased it as, I know you're going to be tempted to go on even the smallest ride. Any form of jostling, jumping, whatever, any form of vibration is going to potentially flare you up. Now, what that's going to do is set you back at least 4 to 6 weeks. So if you're going to extend that, just know that your rehab process was scheduled to be, 4 months. Now it's going to take you up to 6 months if you flare this up. Now, when you put it in context like that, because now you're adding time to the recovery, I don't think they would have done it in the beginning. So, lesson learned, I should have been better at giving that prescription or giving that bumper, that yellow light, that precautionary prescription, so that they can make that decision even better. Now, would you have done that? It's hard to say, but now knowing what I know now, I would have just given more information beforehand so they can make that best decision. And that's how I empower my patients and athletes. That's really what I give them, is more and more education. Not necessarily exercise, because I think that most people can YouTube or Google exercises and they're gonna come and go all they want. But what they really enjoy is having the knowledge and awareness of what can hit them and how that impacts them down the line. That is so powerful, because that's what people want. That's what clinicians want. Like you listening to this podcast, you're like, what can I apply so that I can set my clients and patients and athletes up for success? Now, that's not always going to be very, what I call tactical things, like the manual mobilization or whatever it is, because I think that you can learn that anywhere. But what you need to know is what is going to hit your patients and athletes that you don't know yet, that can be a game changer in your professional development. And that is true learning. I think learning is when you take one thing that you did and you can now have lessons learned from that and then apply it to the next. I think the faster you can do that is the faster you accelerate down that specialist, like leading sports PT track, not a certification. It's just getting more lessons learned, applying them, and just constantly building. It becomes this exponential increase in professional development. I see it happen. Like I literally mentor people and I'm like, I could see the amount of growth exponential within 1 year versus linear with skill-based learning. Skill-based learning is, I mean, I think of the past. I think that's going to take you to a certain point. It just won't launch you anywhere. I think you're going to be stuck on this plateau. So that's number two. Number three is a shoulder case. Now, don't laugh. This one is straightforward. This one was a post-op slap repair. And I thought, okay, this is easy peasy. I've got this case down. This is also younger in my younger self, still learning and adapting. And I couldn't help but like hit myself on the head out of frustration from this one. All right. So we have somebody in their mid-20s, constant dislocator. And they ended up having a slap repair and multiple procedures. And it was pretty straightforward. And we are about 4 or 5 months out. And they said, hey, so I am going to go, I want to get back into the gym. I want to do some variations. I want to do lower body stuff. Okay, no problem. And I remember them coming in one day, flared up. And I said, what happened? I said, well, you said I can go back to gym. Yeah. You said I can get back to like daily stuff. Yeah. Normal, like just using your arm without slings, without any modifications during your ADLs. So what happened? I said, well, I was walking my dog and the dog started chasing another dog, and I tensed up and I like tugged on the actual leash. And at that point, my head just dropped, my shoulders and everything just sunk. And I said, I'm so sorry. I didn't tell you that. I failed to tell you to either put the leash around your waist or don't hold the leash with your operative arm. Now you can say like, well, that's common sense. Not to every patient, not to every athlete. It's not fair. And that's the way I internally, that's how I see myself. I'm always looking at myself and like, why didn't I set them up for success? Yes, it's 100% their fault, but what I should have done is outline things that are about to hit them at that stage that they get really excited about. But if they do it, they're just going to launch backwards. So the lesson I learned off of this case and this person is that even in the certain timelines, I think as a new clinician, you don't know, like general frameworks, but you don't know the problems that arise at that stage until you encounter that many people. So I think people start to get comfortable. I think any post-surgical case, they get comfortable around 4 to 6 months. They're like, oh, I can do this by myself. I don't need much help. And that's where the most trouble arises. And that's unfortunately when a lot of times insurances like start to cut visits and everything else. But that's where it's almost like you let them fly, but they don't have their wings yet. They haven't even like learned everything, and you just want to be able to support them. So what I would have done is I should have outlined, hey, you're now 4 to 6 months out. Here's the 4 things that are going to hit you. You're going to start doing these things. No jostling, no bench pressing, no blah, blah, blah. Just outline the things that will hit them in this stage of healing, this framework. If you don't do that, they're going off of your old precautions, like from like week 1 or week 2 or week 5 or whatever it is. And you always have to be updating those things and giving them, here's the green lights, here's the red lights, and here's the yellow lights with ADLs and fitness. If you can do all 3 warnings with ADLs and fitness, you're probably going to cover the majority of challenges that can hit them. And most people don't think like this. They're going about their day, right? Like they don't care about the shoulder anymore. They're like, I just want to get back to it. And your obsession is just don't mess it up. Like, this is my art piece. Please don't mess it up. And the minute they did that, obviously, the physician, the surgeon, was not happy about that, and I got reamed. That's why it's so memorable in my head. I remember thinking, I messed up badly, and you can easily say it's the patient's fault. Totally get it. Totally get it. But I should have instructed them. So now when I have any slap repairs, any shoulders, I'm like, no kids, no dogs, no like holding people, like anything that can be dropped, I get it away from you. And that's why I tell people conservatively, I think they should be wearing slings as long as possible, not for literally the support, but for the external environments. Like, how many times have you had patients or athletes tell you, man, since wearing this sling, people come up and they just like hit me on my shoulder and they don't know, or I wasn't wearing my sling and somebody just came up and grabbed my shoulder real hard and said, Dick, how are you? And you're like, oh my goodness. So those slings act as a deterrent for most people because they see it like, oh, didn't know that. So that's why I think crutches, I think slings are great. I am a big fan of delaying them as much as possible, keeping them on, not like for all day use, but when they're out in public. I mean, it's going to be like an hour or whatever it is. I think they have to have it on because you never know when it's going to hit them. So the slap repair, 4 to 6 months out, started walking their dog and just messed it up. They didn't have to go in post-surgically. They just flared them up, set them back about a month. So if you're, my obsession with post-op cases is like to get them to certain criteria at certain points. So when they mess up or they derail, where did I not provide the bumpers? And then where did they fail to execute? And did they fail to execute because I didn't provide those bumpers? Then that's my fault. If they did it, completely their fault, and I can sleep better at night. But if you're just relying on your setup of precautions from the beginning and you're hoping they remember that, they don't even remember what they had for dinner a couple nights ago. Neither do you. What I'm saying is you're just a constant reminder service, especially post-operative, to set them up for success and give them the guidelines repeatedly. Hey, I know we talked about this last week. What are your precautions? What are your precautions for this phase? So just remember that you are a constant reminder service. You are not just a physical therapist providing exercises. You're a reminder service. These are what you're supposed to do. This is what you're not supposed to do. And somewhere in the gray area, these are the things that you're okay to do for now. Can you repeat those to me? Great. What questions do you have? And when you leave everything like that, and you do that on like literally every visit, if not every single week, they're just set up for success. And it sounds like really basic and really childish to be like, what's your homework for the week? That's what people love. I don't care if you're an adult. Like some of you, whether you're 27 or 42, you always need those reminders because life is just chaotic. You have so much going on, and these people need that support. And those are the lessons that I learned with those 3 post-op cases. So I hope that you do not make those mistakes. Do not do these things. Give them more answers early on. So I hope that helps, and make sure to give people more information more frequently and be their reminder service. So I hope that helps. I will see you guys on the next episode. Take care.